tonight. Been away for a couple of weeks and back now, back into it. Had to set things up, which has made me a little bit tardy, a little bit tardy biggie, but nevertheless here now. So double screening, as it were, on the gram to my right and the book straight ahead. So and the tube triple streaming. So we're on the YouTube as well, because I am quite an established YouTuber, in case you didn't know. So if you haven't followed me on YouTube, you don't follow people on YouTube, do you? Subscribed to me on YouTube, then please do so, because I've got stuff on there. Anyway, so we've got some questions tonight. I don't know, I'm on my laptop, so I'm assuming my laptop's kind of got a built-in microphone. Yeah, I think it has, hasn't it? Right then, so I'm going to get straight into it, if that's okay. Time waits for no man. So the first question, if you don't mind, I'm going to kick off with this one, but please feel free to chip in if you've got one of your own. Goes something like this. Is it worth considering a crescent lift if you do not want the scarring of a full mastopexy? Well, a lot of these questions, most, if not all of the questions really, certainly in the plastic surgery world, are quite subjective. The responses are quite subjective. So I'm going to give you the response of my view on it, but it does not mean that this is what everyone would say, because obviously, well, maybe not obviously, I mean, a crescent lift exists as a procedure and people are out there doing crescent lifts. So if it wasn't worth it, they wouldn't do it. So there's obviously people out there who think it is worth doing crescent lifts. Do you want to be in my live video? I'm assuming. Right, I've got a request. Nita, you've requested to be in my live video. If that's a misclick, I'm going to ignore it. If not, let me know and I will by all means split screen sort of with you if you're interested in having a chat. So crescent lifts do exist in the world, and so there are people out there who do crescent lifts. My personal view on crescent lifts is that they don't really do a lift of the breast. They're not really a breast. They're really an areola lift. So if your areolas are not level, they will lift an areola. The only thing about a crescent lift, because you're taking skin from sort of above the areola and pulling it up, it will tend to elongate the areola a bit, and I don't think it gives any significant breast lift in terms of skin tightening of the breast, and so I don't do it. I don't do a crescent lift, and I also don't do a circumferential circumareolar lift, but that's just me. People do, and the techniques exist. So it's really and goes back to one of the things I often say to people, which is that it's more important to choose a surgeon rather than worrying too much about the actual technique that they're going to use within limits. We've all got our own views about different techniques, and I completely understand why someone doesn't want the scarring of a full mastopexy, but in my view, you need at least around the areola and straight down for any significant degree of lift, which would be the lollipop or circumvertical scar. So that's kind of where I would be on that. I don't do the crescent lift or the circumareolar lift, but as I say, they exist in the world, and there are surgeons out there who are doing it, and so I'm sure they're getting good results. And if they're getting good results with it, then you may well be able to find a surgeon who will be able to do that for you. So if you specifically want a crescent lift, then maybe you could find someone who could do that for you, but I'm probably not your guy. Well, almost certainly not your guy if you specifically want a crescent lift, because it's not really my bag. Right, this thing keeps on flashing here, so I think you want to join. So I'm going to accept your request to join, Anita, to see if you want to join. So if you want to talk to me, I'm not quite sure what happens when I accept your lift. Oh, you declined. Oh, okay, so maybe it was a misclick. Sometimes people misclick that, but if you do want to chat with me live, we can give it a go, see what happens. But but usually it's a misclick. So what we've got here, sorry, not sure why that's come out. Okay, don't worry. Do you offer treatments to tighten skin and stretch marks? It's my tummy area, not too severe, but with aging, it's not recoiling as much following weight loss and working out these past few years. No. And I know people, I know I probably should. There are treatments to well, you have two things: tightening skin and stretch marks. I don't really know anything good for stretch marks. I don't really know of any good treatments. It's a bit dark, isn't it? Is there anything I can do to light? How about if I turn a bit? Is that better? Is that a bit lighter? So I don't know of any good treatments for stretch marks at all, personally. In terms of skin tightening, again, we probably should do this. This is sort of non-surgical world, radio frequency, and there are sort of machines that deliver energy to the skin that is proposed to cause skin tightening. But we don't do any non-surgical work at the clinic. It's a purely surgical clinic. So we do surgery. We're all plastic surgeons and we do surgery. So in order to tighten skin, the way we would do it would be surgery. And that's basically body contouring surgery, which is breast lifts, arm lifts, thigh lifts, face lifts, tummy tucks. Well, we don't do facelifts, but you know, all these lift type operations are skin tightening operations. But if you're looking for treatments, which kind of just non-surgical, we don't do that. I usually recommend Claire Oliver, who is at Air Aesthetics in Henley and Arden, who kind of specializes in non-surgical. Some people specialize in non-surgical, some people specialize in surgical. So, you know, I would recommend it what someone who's sort of does non-surgical, really, rather than someone who doesn't. I wouldn't really recommend someone who doesn't. So that's me. So, I mean, I don't know if I'm 52. And I don't think I want to start learning anything new. I probably shouldn't be saying this live on TV, because if I do start doing non-surgical, then, you know, they'll probably say, oh, you said you didn't want to do anything new. But I tell you, as I sit here now, you know, I spent a long time learning about surgery, doing surgery and stuff. And it's just another world, the non-surgical world. And I just feel that there are some people out there, that's all they do. They've done it all their lives, sort of thing. And I don't want to do it. And I know people say I should do it because, Cocoon Aesthetics, what's that? You're crying or laughing? I don't know. Because I've got a clinic and everything, and it's nice for people to come to the clinic. And I would like to have something at the clinic where people can come and, you know, and spend a bit of time at the clinic, because I do believe in trying to build a community. That's what I'm trying to do in my clinic, and non-surgical work would probably do that. But I don't do any. I don't know. That's just how it's worked. Here we go. You and your team, enough. You're welcome. Kelly Lee, you are very, very welcome. Any time, Kelly, any time. Cocoon, laughing, you're funny. You don't need to learn. Right, yeah. Well, I probably do. Well, I don't. People say I should get into this non-surgical stuff. Other surgeons got clinics and stuff. They all say you got to do non-surgical and everything. But hey ho, here I am, and I'm not doing any. And I'm in a hotel room with a 8-pack of pain au chocolat and a carton of cranberry juice. That's what it's come to, guys. That is what it's come to. Anyway, you make life choices and you have to just stick with them, don't you? So I've made my life choices. So I'm not going to fuss and grumble. I'm not going to complain. I'm just going to get on with it and answer the questions, because that's what I do. Okay, so let's stay with the program. We've got a question here about a tattoo. I have a tattoo that goes all the way around my ankle. What are reasonable expectations regarding the scarring if I wanted tattoo excision? If you got a tattoo that goes all the way around your ankle, that is going to leave a bad scar. So I would say just on that alone, saying I've got a tattoo that's going all the way around my ankle, I'm going to go out on a limb here and say that is not a good tattoo for an excision. Reason being, it would give you a circumferential scar around your ankle, which wouldn't be great. And the ankle's got really tight skin. There's not a huge amount of spare skin because you've got to remember your ankle's got to move because you've got to walk. So unless it's kind of like a line, but if it's a line and we cut it out, then it's going to give you a line scar. So what's the point in doing that? It'll be a scar instead of an ink line. So I think the reasonable expectations would be to do laser, really. And I don't think sounds like a particularly favourable tattoo for excision ankle. We've done some around the arm, which has worked quite well. That's a bit different. That gives like a linear scar. But the ankle, I think that would be a worse place for a scar. Now, Sam Van has asked to join the live video. I'm assuming, Sam, it's a misclick. But I'd be very happy to have you on board if you want to promote your new business venture. So Sam has got a new cafe. So you're welcome to use my platform and my 5 followers. Well, actually, you're one of them. My 4 followers to promote. But let's not forget Facebook and YouTube. Yeah, you want to get on? Okay. Go live. There you go. I'll click go live. Oh God, has that worked? Accept. Right, there we go. We split screen. I'm with you, Sam. We've got a lot. Now, this isn't going to work for Facebook and my Facebook and YouTube followers, plural, because both of them. So they're not going to be able to see this, but I'm sure it's going to be scintillating conversation with Sam. Who knows? She might be going live from her new business. Sam, are you there? Are you at your new business? Oh, you've gone. Okay. Well, we've lost Sam on the live broadcast there, but maybe she'll be back. But yeah, we'll carry on. And if we can get, if the people in the back office can get Sam back on, we can do a live chat, which will be the first, which will be very interesting. If anyone wants to do a live chat, very happy to chat with you live, as long as you don't swear and keep to the same exacting standards that the live Q&A is used to. So yeah, tattoo around the ankle, not great, I wouldn't have said. How long after giving birth before I can have breast augmentation? I am not breastfeeding. I always say the best is a year, but I understand that a lot of people are on maternity leave for a year and so want to have it done before then. So I think the kind of standard, I think most people would say 6 months. I think 6 months is standard after giving birth. The reason being that your breasts will kind of settle after giving birth. So 6 months is the normal to see how they settle and see how the shape changes. It takes longer than to settle if you are breastfeeding. Obviously, breastfeeding is good. But you want to have a period of time after breastfeeding to let the breasts settle, recoil the size. They'll kind of get smaller and they might settle in terms of their shape. So you've got to give it that time to let the breasts settle so that you can see what you're dealing with. So you're working at a level playing field. So 6 months is kind of our minimum. I think a year is better. The other thing to consider if you have just given birth is you have got a small child at home. So that is something to consider. If you're having surgery, having a 6-month-old at home would be quite hard. Maybe a year, maybe they're starting to walk and that might be a bit easier to manage possibly. But yeah, so I normally say a year. 6 months is normal. So if you want it done before your maternity year ends, often we do it around sort of 10 months or something or what have you. Oh God, sorry, I'm waving. Sarah's got a message. Would you refer your clients for laser tattoo removal instead of surgical removal more often? Also, would you consider referring patients to erbium scar reduction? Yeah, I mean, I always tell patients to try laser first line. So laser, I feel that in terms of tattoo removal, laser is first line. So pretty much, I would say pretty much everyone would have had a laser, would have tried laser that I see. I can't off the top of my head think of anyone who hasn't. I guess the only situation with someone who kind of like got a job interview next week and is it gone sort of thing, but that so obviously excision is instant, but of course excision leaves a scar. So for sure, I think I say I'll tell all my patients to go for laser tattoo removal, but first line. Would you consider referring patients to erbium scar reduction? No, I don't. I got to be honest with you, Sarah. I'm not sure what erbium scar reduction is, but if it's kind of like laser scar reduction, not a great believer of it. I think that most scars settle. If the scar is persistently red, then I might suggest laser, but most scars settle with time, and I'm yet to see any sort of compelling evidence about lasers and scars. What I'd like to see is treating one half of the scar with laser and one half not, and showing a difference. Because often with things like laser and things like silicone gel and what have you, people will say, look at this scar, and we use the silicone for 6 months, or we have so many sessions of laser, and look how brilliant it is 6 months later or a year later. But often scars get really good even without laser or gel. I usually just say moisturize and massage. Often scars will settle. So what you really need to do is kind of do part of the scar, treat part of the scar and not the other part, to show that it's actually the laser or what have you making the scar better. So yeah, I don't refer patients for erbium scar reduction, but certainly do recommend laser tattoo removal prior to excision for sure. So yeah. So done that one. What we got here? What can I expect following implant removal with no breast lift? How will they look? Who's asking that? Who is asking that question? Well, funny you should say that. So you can expect to have smaller, less full breasts, similar to how they were preoperatively. In fact, they will look worse than they looked preoperatively because the skin has been stretched. And it really is about having a discussion with the patient to decide whether they're going to be comfortable with that shape. And presumably there's a reason for having the implants removed. And that's the thing to focus on. Implants are really shape and volume to the breasts. And so if you remove the implants, you're going to lose that shape and volume. So you've got to think, why are you doing this? So if there's a problem with the implant or what have you, then you've got to say, well, at least I'm getting rid of that problem. If you're worried about the fact that you're going to lose the shape and volume, well, you could put another implant back in again. But then you perhaps run the risk of problems with implants, which are not without problems, faux show. So if it's purely shape, you could think of having a lift. Oh, that's what you're saying with no breast lift. Yeah, so breast lift would improve the shape, but it wouldn't give the same fullness as implants do. So even if you did have a lift, you'd have to accept that. And so what I normally say is, like, if you're having the implants removed for a reason, I mean, it depends on the patient, examine you, what have you. There's a lot to be said for just getting rid of the implant, seeing how you go. And in my experience, people often are okay with it. They accept that there's been benefits in removing the implants, and they accept the shape has gone, the volume's gone. Maybe the implants have done their job, whatever they, when they had them at the time of their life. And you could always have a lift at a later date. Now, some people say, look, I'm not going to be happy, particularly if they've got large breasts. If the breasts are already sitting low, particularly if they're sort of falling off the implants, you might say, well, look, that's fine. You can just have one operation with the implants removed and a lift. But it really is a personal discussion with the patient. We need to examine you and see what's what, to see whether a lift would be a good thing to do at the time of the implant removal, or just to see how the breast settles. But often in my experience, the breast tissue does recoil and it gives an acceptable shape, but it gives a shape of a breast which hasn't had implants in, which hasn't got implants in. But because they've had implants in, they will sit a bit lower than they did preoperatively, before you ever had implants. So it's something to be kind of prepared for, if you like. Well, I've got to be honest, it's quite a crazy one today with all these people trying to join, but sorry we didn't get to join with you, Sam, as it were. So yeah, all right. Well, I am going to go sit on that bed and watch a bit of Antiques Road Trip if there's no pressing issues at this juncture. I'm going to wish you all a good night. It's great to be back. I know I've been away for 2 weeks. Great to be back. Currently on location, but should be back at base next week. Same time, same place. 7 p.m. Yeah. Ask your questions. Call me. WhatsApp me. Yeah, we're using WhatsApp a lot more now. Don't know what you feel about that. There's a button on the Facebook page that you can WhatsApp people if you've got a question. And you never know, you might find yourself on next week's show. Thanks, Jackie. Lovely to see you. Thanks for the beginning and end. Thanks for supporting it. And yeah, I'm going to go and have a lie down. See you next week. Ciao, ciao. Stop the stream.